But experts say 80% of New Year's resolutions fail by the second week of February.
In this morning's Focus on Your Health, Teresa Snow has some tips to keep your diet on track when you want to reach for the junk food.
Focus on Your Health is sponsored by MU Healthcare.
Well, every year, losing weight and eating better are some of the most common New Year's resolutions. I usually make one like that, but they're tough to put into practice. And joining me now is Ashley Ritzo, a clinical dietitian with MU Healthcare. Tell us a little bit about the diets, keto, paleo, Whole30. I hear people on all of those. Do you recommend a specific diet?
I don't usually recommend a specific diet. I think we should look at it from a broader perspective of lifestyle behaviors that need to change and set more actionable goals that you can sustain over a longer period of time.
You said to me earlier that most people know what to do, they just don't do it.
Right.
How do you work with that?
Well, we do a lot of exploration and trying to connect these behaviors that seem so insignificant to what is important to the person. So, for example, if someone wants to retire and be able to travel and move around more easily, get up and down off the ground, playing with their grandchildren, that's what's important to them, and establishing healthy lifestyle behaviors can help them do that more enjoyably.
Now, here at the Academic Health Center, you're a clinical dietitian. What are the types of patients you work with?
I work with a lot of patients who are just looking to establish healthier lifestyle and maybe lose some weight, but I do a lot of diabetes, heart disease, kidney disease, some of my main patient populations.
Tell me about some of their unique needs.
Well, of course, when it comes to diabetes, we're talking a lot about consistent carbohydrate intake, not necessarily low carb, but more consistent and more whole, unrefined carbohydrates. For heart disease, we talk a lot about just choosing lean proteins, whole grains, lots of fruits and vegetables, and how to actually implement that. And kidney disease is a little more unique. It kind of depends on the stage that the person is in and what their lab values look like.
Sounds like it can be complicated. What's the advantage of working with someone like you to set the plan?
Well, all of our dietitians here are registered dietitians, and that means we go through at least a bachelor's degree and 900-hour internship, and we have registration exams that we have to pass before we're able to practice.
Now, you work with a patient, but sometimes you have to get the whole family on board because it's a lifestyle change that may drip over to others. Do you work with that as well?
Well, I see a lot of course, mothers and fathers, and I work more with adults. We do have pediatric dietitians that specialize in that. But for the moms and dads out there, we do have to talk a lot about the kids' food preferences. My best suggestion is get them involved, and if they're helping to prepare the food, they're more likely to try it. And if they can make their own plate too, I think that helps them eat better.
Good advice. Thank you very much. Ashley Ritzo, a registered dietitian here at MU Healthcare. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.